Your feet know first. The 7 diabetes warning sign you should never ignore. What if your feet are trying to warn you about diabetes right now, but you are completely missing the signs? Many people think diabetes starts with thirst, fatigue, or high blood sugar readings. But in many cases, the feet begin showing warning signs months or even years before serious complications develop. Today, you will discover 7 foot symptoms that doctors never ignore, why they happen, and what you should do if you notice them. And make sure you stay until the end, because the final warning sign is one of the most dangerous, and many people don't feel it happening. Let's begin. Warning sign number 1: constant tingling or pins and needles. Have you ever felt tingling in your feet that seems to come out of nowhere? Many people dismiss it as poor circulation or simply getting older, but persistent tingling can be one of the earliest signs of diabetes nerve damage. Here is why. When blood sugar remains high for long period, it can damage the tiny nerves in your feet. These nerves start sending abnormal signals to the brain. The result: pins and needles, tingling, burning sensations, or strange electrical feelings in the feet. People over 45, those carrying excess weight, and people with a family history of diabetes are especially at risk. If these symptoms keeps returning, don't ignore it. Your feet could be sending an early warning. And the next sign is even more common. Warning sign number 2: numbness in the feet. This one surprises many people. Instead of feeling more sensation, some people begin feeling less. At first, it may seem harmless. You step on something sharp and barely notice. You walk barefoot and can't feel the floor properly. Your feet feel unusually dull. This happens because damaged nerves stop carrying signals correctly. The dangerous part: you may develop cuts, blisters, or injuries without realizing it. And those injuries can become serious infections. In fact, loss of sensation is one of the biggest reasons diabetic foot complications occur. But what if your feet actually hurt more than normal? Warning sign number 3: burning feet at night. Do your feet feel like they are on fire when you are trying to sleep? Many people blame their shoes, the weather, or fatigue. But nighttime burning can be linked to diabetic neuropathy. High blood sugar damages nerves and causes them to become overactive. The brain interprets these abnormal nerve signals as burning pain. Interestingly, symptoms often become worse at night. When there are fewer distractions, some people describe it as walking on hot sand. Others say it feels like their feet are being stung, and what comes next might be visible without feeling any pain at all. Warning sign number 4: slow healing cuts or blisters. Take a close look at your feet. Do small cuts seem to take forever to heal? This can be a major red flag. Diabetes affects circulation. When blood flow decreases, oxygen and nutrients have a harder time reaching damaged tissues. The body's repair process slows down. A tiny blister that should heal quickly may remain for weeks. A small cut can become infected. Doctors pay very close attention to wounds that don't heal properly because they can be an early clue. that blood sugar levels are causing damage behind the scenes. But there is another sign many people overlook completely. Warning sign number 5. Extremely dry or cracked feet. Most people think dry feet are just a skin problem. Not always. Diabetes can damage the nerves that control sweat production. As a result, the skin becomes unusually dry. The feet may crack, the heel may split, the skin may become rough and flaky. Why does this matter? Because cracks create openings where bacteria can enter. And once infection develops, healing becomes much harder. Now let's talk about something that can appear even before some of these symptoms. Warning sign number 6. Changes in foot color or temperature. Have you noticed one foot looking redder, paler, or darker than usual? Do your feet often feel unusually cold or strangely warm? Blood sugar problems can affect circulation. When circulation changes, the color and temperature of the feet may change too. Some people notice their feet remain cold even in warm weather. Others develop redness or unusual discoloration. These changes shouldn't be ignored, especially if they appear suddenly or persist. Now we come to warning signs doctors worry about most. Warning sign number 7, foot ulcers or open sores. This is the symptom you never want to ignore. A foot ulcer is an open wound that doesn't heal properly. Many people don't even know the injury that started it because nerve damage reduces sensation. The sore grows, the infection spreads, and complications become much more serious. This is one reason diabetes is considered a whole body disease, not just a blood sugar problem. The encouraging news: most severe complications can be reduced when warning signs are recognized early. What you should do: if you've noticed one or more of these symptoms, don't panic. Many conditions can cause similar foot problems, but don't ignore them either. Check your feet every day. Wear properly fitted shoes. Keep your blood sugar under control. Stay physically active. And most importantly, speak with a healthcare professional if symptoms persist. Key takeaway: your feet are more than just something you walk on. They can provide some of the earliest clue that diabetes may be affecting your body. Tingling, numbness, burning sensation, slow healing, dry skin, color changes, open sores. These warning signs deserves attention. The earlier diabetes is identified, the better your chances of preventing serious complications. If you found this video helpful, subscribe and turn on notifications, because every week we uncover hidden health warnings that could help protect you and the people you love. And before you leave, take a quick look at your feet. They may be telling you something important.